Why does pain occur after root canal treatment? Root canal treatment is the procedure of removing the nerve and blood vessel tissue inside the tooth and cleaning and filling the root canals. So how can a tooth without nerves still cause pain? In fact, the pain does not come from the tooth itself, but from the bone tissue surrounding the tooth. This bone tissue contains nerves, and the procedures performed during root canal treatment can cause temporary sensitivity and reactions in this area. Mild pain after treatment is completely normal. It usually decreases within a few days. In fact, we consider this process normal for up to 2 to 3 weeks. However, if the pain is severe or lasts longer than 2 to 3 weeks, there may be an underlying problem. During treatment, the procedure reaches the tip of the root. This can cause temporary sensitivity in the surrounding bone tissue, and this is normal. If the canals are not properly cleaned, for example, if one root is treated but another is left untouched, the remaining bacteria can cause pain. Root canal treatment is a millimetric procedure. If it is finished before reaching the root tip, a space remains inside, bacteria multiply, and an abscess can form. If it is overfilled, the filling material may extend beyond the root tip and cause irritation in the surrounding tissue. Sometimes root canals are very complex. Even if the main canal is filled, there may be unreachable side canals where microorganisms remain. In this case, pain may persist and infection may recur. As treatment, the canals can be removed and cleaned again and refilled. This is called retreatment. Or apical resection can be performed, which is the removal of the unreachable root tip and treating the remaining root structure. In some cases, the canal tip may be blocked and it may not be possible to reach the end. This prevents the treatment from being completed ideally. In such cases, the canal may be filled up to the blocked point or apical resection may be performed. Cracks in the root are one of the most serious problems and can cause persistent pain. They may also lead to abscess formation. In this case, bacteria can easily spread, and unfortunately treatment is not possible. Extraction is usually required. Even if the root canal treatment is performed perfectly, pain may occur again years later. The main reasons are cracks or fractures in the upper filling causing leakage or new decay forming from the sides and infecting the filled canals. In this case, bacteria can re-enter the canal and cause a new abscess at the root tip. If the pain continues, the first step is to evaluate the tooth. If a problem is detected, the root canal treatment is repeated, retreatment. However, keep in mind that with each retreatment, the chance of success slightly decreases. In some cases, pain may persist even if everything is done correctly. This may be due to resistant bacteria, unreachable canal structures, or root fractures. But these situations are very rare. Pain after root canal treatment is usually normal and temporary. However, long-lasting or severe pain must definitely be evaluated. A successful root canal treatment is completed not only with proper technique, but also with a well-sealed final restoration. If you have experienced something similar, feel free to share your experience in the comments below. Take care of yourself for now and see you in the next video.